rates? No? Yeah?
Sure, no.
Whatever she says.
I'll say it. Yeah, it was a good guess. I mean, okay, so I'm going to start out really broad. So I'm Bryn Taylor. I'm in Romeo Morrow and Rob Knight's groups at UCSD. I'm a grad student there. So first, I just want to say thank you for inviting me and this opportunity to speak. So millions of Americans are affected by one or more of these diseases, and trillions of dollars are spent on research, management, and treatment of them each year. But they have something in common, and that's an immune-related inflammatory component, which has been identified as a potentially critical drug target. So this inflammatory component is a G protein coupled receptor called chemokine receptor type 2, or CCR2. And CCR2 mediates immune cell migration. It's involved in monocyte infiltration in the inflammatory diseases that I just mentioned. And it's also involved in the inflammatory response against cancerous tumors. Notably, it's involved in nearly 24 types of cancer. So in the past few years, there's been a huge breakthrough in the crystallization of GPCRs, as I'm sure most of us know. And this is the first crystal structure of CCR2, so of course we're very interested in it. The goal being to design inhibitors to block its signaling and treat the inflammatory diseases that I just mentioned. And in fact, many compounds have been developed to inhibit CCR2, but ultimately they all fail in clinical trials. So some chemokine receptor antagonists have been successful as treatments, such as you might know Maraviroc, which inhibits HIV entry into host cells, that targets CCR5, and a non-Hodgkin's lymphoma and multiple myeloma drug, which targets CXCR4. But we haven't had such luck with CCR2 antagonists. So with that in mind, today I'll be talking about the structural basis for ligand modulation of CCR2 activation pathways using Markov state models. So with a complete understanding of CCR2 dynamics, we'll be better poised to modify existing drugs or design new ones to more effectively inhibit its signaling. So the two systems that I'm working with are APO without anything bound, and HOLO with these, which is essentially the crystal structure and has two antagonists bound. And I ran each system on the Anton 2 supercomputer and got a total of not milliseconds like the previous speaker, but I got 260 microseconds, which is pretty great for sometimes. So as we know, there's a fundamental problem when using molecular dynamics for proteins that have biological movements that take longer than nano or microseconds, and you just can't really reach those timescales with our current compute resources. So on Anton, we're able to take it up to a couple hundred microseconds, and combining it with Markov state models, we're able to practically reach the millisecond timescale, where biologically interesting things actually happen in GPCR signaling. So as we talked a lot about this morning, Markov state model is simply a statistical method to identify kinetically relevant conformational states and the probability of transitioning between those states. So I'm going to talk a little bit about how to actually construct these Markov state models. Just very briefly, you generally do some feature selection, you do a dimensionality reduction, you cluster all the frames, and then you build and validate the model. I did a lot of these things with PyEmma, which is developed in Frank Noe's group, and is a great help. In my case, it was really an iterative process to identify these features, like the last speaker talked about. It's kind of difficult. And so anyways, by iterative, I mean like really iterative. It took a lot of time and pain, and it ended in a graveyard full of failed MSMs. But it ultimately did work really well. I went to the PyEmma workshop about a year ago today-ish, within the month. And so in the past year, I've got it to work, got some cool insights out of it, and that's what I'm going to share with you today. So I mentioned that I optimized these features, and to do this, I started with selecting all inter-residue distances, and then I iteratively pared this down to a minimally spanning set of bases to represent the motions of interest using TICA, time structure independent component analysis. And the features I ended up building my Markov state model on are the network residues around the orthosteric and allosteric drugs. So these residues are also known to be critical in chemokine binding or G protein binding or to receptor activation, etc. Some of them are not. Some of them were just identified from Tika. And they also, if you know GPCR biology, they include motifs like NPXXY, DRY, etc. But basically, the orthosteric residue network is up here in the extracellular side of the protein. It is essentially the chemokine binding site. And the allosteric is in the G protein binding site. So after the feature optimization and selection, we performed dimensionality reduction. Then we projected all the clusters into the Tika feature subspace and clustered all the frames of the trajectories together. I ended up building one Markov state model on the APO data and one Markov state model on the holo data. I have built one on all of the data, but we're just going to talk about these two today. That one's a little more complicated. Okay, so finally, after doing all that, and then you, of course, after clustering, you compute transition probabilities and validate the model. So, imply timescale plots and CK tests to prove that your model is valid and works. And then after that, I coarse grain the MSMs using hidden Markov models to assess the transitions between dominant macrostates. Okay, so here's a free energy of ApoCCR2 projected into the Tika subspace. So I have 6 main macro states, and the white arrows just represent the dominant transitions. And I see that ApoCCR2 transitions relatively quickly between all 6 of these macro states. So between 3 microseconds and 14 microseconds between all those states. And when compared to holo CCR2, it transitions quickly between some of these states in the middle here, and then there's actually some very difficult to access states that take about 50 microseconds to reach. And especially interesting is the state over here and the state over here, these rare inactive states that may suggest other inactive stable conformations that aren't shown from the crystal structure that may be useful for modifying these existing drugs to bind better and create a more effective drug, or maybe design an entirely new drug altogether. So we see that while holo macrostates show these unique and rare inactive states, the APO conformations resemble actually active state GPCRs in some ways. So I'm comparing to the active GPCR US28 in green. The APO are all in cyan, the holo is all in red, and these are the representative structures from the macrostates. And so although it doesn't fully ever reach an activated state, it has nothing to help it get to an activated state, it does show some of these hallmarks of activation. So for example, in helix 7 here, the cyan again is APO, and it's starting to resemble this active conformation, whereas the holo is not. It's sticking with the very inactive crystal structure, that dual antagonist down crystal structure. And similarly, the helix 6 is also kind of resembling this active state, whereas the holo macrostates are not resembling just the inactive crystal structure, but they're actually forming this new conformational state where they're bending outward at the extracellular end and inward at the intracellular end. And then also, so analysis of these more detailed microswitches reveals some information where we have, for example, in tyrosine 7.53, you have the inactive states that are quite like the crystal structure, and you have these apo states that are doing a whole bunch of things that are not like the crystal structure nor like the active state. And then you have one holo state that all of a sudden looks more like the apo state, but is totally different from all of them. And it turns out that state is accessed after the orthosteric ligand dissociates. So this is on the allosteric side, this is on the intracellular side. Once the orthosteric ligand dissociates, this residue changes its conformation. So this is some evidence for some of this crosstalk or allostery between the two ligand binding pockets, which we were hypothesizing that there was some. So that's it's exciting that we do see that just from the Markov state model. So this is some cool things we also found, not necessarily from the MSM, but we found that the There's a continuous internal water pathway that forms an apo but on a holo, and this is evidence of GPCR activation if there's this internal water pathway. We also find that sodium ions can access the core of this helical bundle in these apo simulations, but not in the holo. And there's been some more recent evidence that suggests that sodium ions entering into this core and interacting with certain residues is a critical step for GPCR activation. So we might be getting close to an activated state in this apo simulations, and definitely not in the holo, where it's accessing these very new, different inactive and stable states. So beyond simple structural comparisons between the representative conformations of the macrostates that I've just been showing you, we can also evaluate and compare the dynamics of each system using linear correlation between the input features and TICA components to determine the dominant slow motions of each system. And so for ApoCCR2, this motion is just the rearrangement of residues in the G protein binding site, almost exclusively. And in HoloCCR2, it's the exact opposite, and it's all of these residues in the chemokine binding site. The second dominant slow motion that we looked at for ApoCCR2 is also exclusively one residue, the tryptophan 2.60, that assumes these three distinct positions. So here in gray is the crystal structure, and then I compare it again to the active structure US28, and then blue and yellow are these kind of intermediate states, and the magenta here is the most extreme conformation that sticks way into the pocket. And so this residue is critical for chemokine and other ligand binding. It interacts with the ligand in the crystal structure. But the range of these slow conformational changes in this residue will help us understand the binding mechanism of chemokines in general, and also this ligand, which we're not entirely sure about. So the second dominant slow motion in HoloCCR2 isn't just one residue change like APO, it's actually the dissociation of the orthosteric ligand, which only happens in one simulation, so take that with a grain of salt. But it allows the protein to access a very different conformational space. And so here, the white circles are clusters that have never had a ligand dissociate. The gray are kind of during that microsecond of dissociation, and the black are post-dissociated states. So keep in mind, we didn't build the Markov state model with any ligand information, so this is just understanding that there are some key conformational changes that happen after the ligand dissociates. And so the positioning of this ligand is reflected in each of these macrostates. So like I said, up here, this was colored black in the previous slide, but these are two separate states, purple and white, and here there's no ligand. I'm just comparing it on the base crystal structure again. And in these two states, in DTS and ISA, the gray and the cyan, we see the ligand position itself between, these are densities of the ligand. You see it position itself between helix 1 and 2. This is a top-down view. And then in these two states right here, the yellow and the black, the ISB and CIS, they are positioning between helix 1 and 7, much more like the crystal structure conformation. And then in our special red state I was talking about, it does a whole nother different thing and points towards helix 2, 3, and 4, or 3, 4, and 5. So this state is also very favored. There's very few transitions out of this state. And so this may be a critical thing to look at for should we design other ligands that fit maybe better into this position than the kind of normal crystal structure position. Okay, so in conclusion, coupling these long timescale MD simulations with MSMs lets us see ApoCCR2 accessing these intermediate active-like macrostates. I see that APO and HoloCCR2 have these very different dominant slow motions and overall dynamics. And I see that HoloCCR2 accesses unique intermediate and active states that are distinct from the crystal structure, which will be used in the near future for drug modification and drug design. So with that, I'd like to say thank you for your attention and acknowledge the Amara Lab, mostly Romy, my PI, and lab mates Chris Lee and Amelia Picaro de Barros. and funding sources and simulation time on Anton and Payama. So thank you.
I know we're a little over time, but thank you, it was a really interesting talk. This is more for the whole floor. You know, for those of us who don't have access to D. Shaw or Anton and can only run shorter simulations, in the last few talks, is there any hope for us if we can't reach these long time scales?
It depends, I think, of what system you're working on. So with Anton, it was pretty critical, I think, for GPCR motions to have this amount of time. It would kill for 6 microseconds or milliseconds instead of just that, but you know, not sure.
Shouldn't we be able to reconstruct that just with a bunch more GPUs?
Yeah, you can.
Yeah.
And then the next step also for this, like, I think ideally I could, well, I'm going to do a whole bunch of other adaptive sampling, you know, after this. And if you can identify some key states and just spawn a whole bunch, you know, that would be definitely doable. And then stitch it all together with Markov state models. I mean,
Actually, can I follow up on that? You said, could you do it with a bunch of GPUs? And as someone who's not an expert in this, it doesn't seem to be obvious you can, because if you have a long simulation, then you are starting all your short chunks of short simulation from different places in configuration space. So it seems like you could only do that with a large ensemble of shorter trajectories if you have a sufficiently clever adaptive sampling method. Is that a correct statement that I'm making?
yeah, I think that some of these things, at least for my system, it would be kind of hard to do a lot of short simulations just to start. I kind of think you need to do, in order to get the intuition of the system and how it's actually changing, I feel like you need to do some long time scale and then adaptively sample after that.
One of other Rome's postdocs did with accelerated AMD and then speed it off from the combinations that he generated using AMD and then went further AMDs from those tools.
Yeah, that's a really good point. Yeah, you can do some sort of AMD or something and then adaptive sampling.
I think in the interest of time, we should thank our speaker again.